Hey, so this is a talk I give every year to the medical students. And so I think it'll lead us to a lot of discussion. So I'm happy about that. So I thought I would talk about it with you guys. So the medical school, probably about 15 years ago, started a department of complementary medicine. And then it subsequently changed its name to Department of Integrative Medicine. But then it actually ended. So we no longer have that department because it actually, when Roseanne Harrigan passed away, it transitioned in the Department of Quantitative Sciences. But I don't want the medical students or any of us to forget about how, by listening to everybody's opinions and needs, we can be better providers. So I give this talk every year, even though we don't have a department, because I want the first year medical students to be aware that I think every single patient uses something not traditional Western medicine. And if we don't know about it, how do we help them integrate it? How do we keep them safe? How do we really best be their best healthcare provider? So um, that's why I give this talk. And okay, so alternative medicine is just that. It's another type of medicine instead of conventional or Western medicine. So I think it was Steve Jobs who has the same kind of cancer as my uncle does. And he said he went to Mayo Clinic to the same doctor, and probably this doctor shouldn't be talking about him, but when my uncle went, he says Steve Jobs had the same kind of cancer. It's pancreatic cancer, but it's an adenocarcinoma. And, or no, wait a minute, sorry. It's not an adenocarcinoma. It is a um, carcinoma. Um, I'll get the exact name of it. But instead of doing the chemo for it, he decided to do alternative medicine in place of. And he's no longer with us, but my uncle is. My uncle's been on this different chemo. They've switched him around, but for um, 10 years. So he's been alive with pancreatic cancer for 10 years, and that just doesn't happen. So let me make sure I've got chats covered here. Let's see. Work stress topics. Okay. So what do we say about this? I'll tell you what. We don't call it that anymore. Although I have trouble, I keep calling it that. In the talk I gave to the med students last week, it was funny. I kept saying alternative, and I try never to say alternative. So anyway, what we want to do is call it, well, okay, we don't even have to get to what we call it yet. Complementary. What does complementary mean? Somebody tell me what they think complementary with an E. Wait a minute. Complementary. I actually think I have it spelled wrong here. Complementary versus complementary.
So it's like in addition to, you're not replacing anything, you're supplementing essentially.
Yes. Okay. So this is okay. So a complement. Okay, good. I have it spelled the right way. Thank goodness. Woo. Yes. So complementary means in addition to. So combining in such a way as to enhance or emphasize the qualities of each. Um, as opposed to complementary, which is a compliment, expressing a compliment or praise. So yes, exactly right. So use of something together with Western medicine. So, like aromatherapy to decrease discomfort. And I think we had a chat too. So, we definitely like this one. And let me check the chat. It is a bit of a bugaboo to check chat at the same time. Chat. In addition to, exactly correct. So, and then there's integrative medicine. So, what does this mean to people? Because we hope this is what we're doing. So integrative medicine, well, to integrate, to weave it together, to bring it into the whole picture. uh, combine it, mainstream medical therapies and what we used to call alternative, right here, I still have it on the slide as CAM, but let's put it all together. And what I tell the medical students and what I'm going to tell you is, you know, a patient trusts you if they're going to tell you about what they're doing because their auntie told them to do it, or their mom said they should try this, or anything that they think is quote unquote crazy. If they're telling you those things and making sure it works with what you're giving them, you know they trust you. And that's a really good feeling. And a lot of these not so mainstream therapies do a lot of good for people. And especially if they're used with our therapies. So we really love these guys. Yes, I'm a little simplistic in my slides. So there are 5 type of classifications of alternative, integrative, complementary medicine. In this world, there are completely alternative medical systems. And you guys know this, I don't have to tell you this, but I didn't know this as a medical student. So Chinese medicine, it's a system developed completely independent of our Western medicine, and it's got herbs, it's got acupuncture, it has a whole system of medicine. It's got a whole medical school training system. It has everything, just like we do. It's just separate. India, they have a whole separate medical system, Ayurveda, yoga, everything, completely separate from ours. And yet, wouldn't it be better if we used everything? And so there are these alternative medical systems that are completely separate, but do we want to think about them that way? No, because they got some really cool stuff. Okay, so other interventions, and most of these are pretty mainstream now, to tell you the truth. I started giving this talk 10, 12 years ago, and there's a lot more mainstream now, especially interestingly because the military has adopted many, many therapies that we would not normally use. And so it's a lot of things have become mainstream. Okay, my theory at chat has always been, if I can't see that it will hurt the patient or interfere with the treatment, go for it. And I completely agree. And that's why it's really good for patients to trust you and say, hey, my auntie gave me this. And I usually say, bring me the box, because I don't know what's in this or that. But bring me the box, let me see, and then I'm going to show you where to look it up. Because it's easy to look these things up. I know it's kind of daunting, but I'll show you where I go. And then you can look up each of the ingredients and you can see if it interacts with anything they're on or not. Okay, so back to the second of 5 types of integrative or complementary medicine strategies, mind-body interventions. So I'm going to say support groups, cognitive behavioral therapy are mainstream, no questions there. Things that have been coming into mainstream more lately, meditation. We've shown it works. It's actually the biggest growing area of people declaring they use it since COVID. No surprise there. But it's the biggest growing area of people saying it's a complementary, now did I say it right? No, complementary medicine practice that I now use. Prayer. Studies show that prayer works. We have no idea why, because you're not touching the person, you're not in the same room with the person necessarily, you don't even know the person, but praying for people has better outcomes. They have better outcomes. Mental healing, many different mental healing therapies, art, music, dance. It is so cool when, and we've had this on Echo, behavioral health Echo, when you have patients who have dementia and all of a sudden they can dance again because they hear their favorite music or the music they're used to. You have patients who can barely move, but if you give them music, they can move and get through the process of what they want to do. So these are really miracle treatments that are not treatments at all. We're just incorporating things that are healthy for us. Art, music, dance. It's basic to human nature And so how can it hurt us? And we're finding it really, really helps people. So that's exciting. You know, what more can we integrate? I think I had a chat. Did I have a chat? No new chat. Okay. All right. So biologically based therapies. All right. So medicines are biologically based therapies, and many of them are based on what is in nature. So natural therapies. Now remember, natural products, natural therapies are not necessarily just out of nature, and they're not necessarily safe in the doses that they're provided. But dietary supplements are used by almost everybody. Herbal products, anything called natural it's not inspected by the FDA. And so we don't know if it helps necessarily, if it hurts. We don't know if it interacts with anything until we look it up. Now, getting shark cartilage is bad for the environment, probably. Does it help with, I think it's supposed to help with your manliness. I don't know. I don't know. Does it? We'll have to look it up later. So let's see here. Oh, another thing I want to say on this is you have to be careful because creatine was being used by a lot of people a few years ago, and some people died because they overdosed and their kidneys were affected. And so we need to know when people are taking different, say not carbo loading is not going to kill you necessarily, but somebody might be carbo loading for something and then trying to lose weight or something. And so, we need to know everything that people are doing. So the teenage guys that were weightlifting and using creatine overdosed on the creatine, killed their kidneys. So we want to make sure they're able to trust us enough to say, I've been using creatine. Is that a good idea? And we can look it up and we can look at the doses and we can see. Okay, manipulative and body-based methods. Well, I love a good massage, so I'm never going to speak out about bad massage. But there are massages that can stimulate areas of the body that maybe you have a deep vein thrombosis in. We don't really want to massage that up unless we know about it and we're anticoagulated, right? Massage in certain areas might be bad for pregnant women, but for the main part, massage is readily accepted, as is chiropractic, osteopathic, all accepted now as mainstream. I wonder if acupuncture goes in this category or in the first category or both. I'm not sure. And then this is the one that I did not used to believe in at all. And I'm going to admit it on here. This was years ago, but this was probably 20 years ago. I heard that a friend of mine had energy healing when she was in the hospital and she was doing better. And I actually think I said to my husband, how could that help? They just put their hands over you. They don't touch you or anything. Well, now I've seen it work. So I am not going to doubt this anymore. In fact, I'm looking for my own energy healer because it's wonderful. And we had this talk a couple months ago, and oh my gosh, I'm blanking on her name. Not Raina, Rui. Rui came and talked to the students and showed how she did it, and it was really beautiful. So these are biofield, and they're intended to affect the energy fields, the chakras in our body, and they work with the energy. So what she did was she went through now I'm going to get wrong, 7 chakras. I think there's seven fields. Did I get that right? They're all a different region of the body. They're a different color, but she can feel them when she puts her hands on or over your body, and she can see where they're clogged. And I am not doing her any justice in my description of it, but she can actually grab that energy and she went like this. So just like that, like, whoa. Now that actually makes sense to me seeing it. So therapeutic touch, Qigong, which is part, I believe, of Chinese medicine. You guys can correct me if I'm wrong, because I even forgot to mention traditional Native Hawaiian medicine as a whole medicine system that developed and has so much beauty to it. And I don't always mention it to the medical students because they have their own talk on Native Hawaiian medicine. But Qigong, Reiki, therapeutic touch, the whole red light and blue light, and I still don't know if some of them work, some of them don't. I don't know. But bioelectric magnetic based therapies are they're so popular these days. The pulsed fields, the magnetic fields, and I don't know if there's that much research on if they work, but there's more and more now because there's different places where you can go and you can get alternating magnetic field therapy or red light therapy, green light therapy. So do they work? Anyway, let's see. Oops, sorry, I went wrong direction. Okay, what do you guys think about what percent of Americans use complementary and integrative medicine? Now, you guys know the hardest part of giving these talks is the long pauses. I have trouble not filling in the long pauses, see, like I'm doing now. So I need some guesses here. I'm opening up the chat. I'm putting it here. And thank you, Beverly. 80%. I think that's pretty close. Magnetic field therapy certainly seems to be of benefit when an MRI machine is. Wait a minute. Do we have therapeutic MRIs yet? I don't think so. All right. We've got everywhere from 10%, 60%, 80%. When we ask Americans who uses 7 therapies, so it's yoga, well, let's see what it is here. Yoga, meditation, massage therapy, chiropractic, acupuncture, naturopathy, which is from a naturopathic physician trained in that through their schooling, and guided imagery or progressive muscle relaxation, which I did in med school because I was so anxious and it totally relaxed me. Okay, only those 7, 36.7% say yes in 2022. In 2002, only 19% said yes. So it's going up. Now, pain is the #1 cause of integrative medicine use. And that's what actually, I just admitted I used it for anxiety. And then I went big into sim stuff with pain because I didn't want to take pain medicines forever. And then meditation, as I said before, meditation has increased the most and yoga the next most. They've both increased like 10 to 20% in this group of mainlanders. Meg says she enjoys when Martin does the yoga sessions. And he does this with the medical students too, because he tries to integrate into the Western system with yoga and other things. So yes, so if you ask on the mainland, it's about 40%. The studies here have not been done since these early 2000s, like 2002, but I think it was 80% here then. I would say it's at least 90% here. Because now, we'll get there in a minute, but the money data, this is from 2016, so this is still a long time ago. But of the $30 billion that we pay out of pocket, we pay $300 billion out of pocket as of 2016. So this is what our insurance does not cover. $329 billion we pay out of pocket. 30 billion of that, or 10%, went to integrative, complementary medicine strategies in 2016. So it's more now. All of this is more because healthcare costs so much. Anyway, this 10% is broken down. Complementary provider visits, self-care purchases, and then non-vitamin, non-mineral natural products. So you can see all those have a fairly large portion of money that we put into these therapies. 10% of our non-covered medical expenses go to complementary and integrative medicine. And 15 billion out of pocket on visits to complementary practitioners, which is about 30% of what we pay with our copay to go to regular doctors, nurse practitioners and PAs. and then 13 billion out of pocket for natural product supplements, which is a quarter of what we pay to the pharmacy in our copays. So this is not little kind money. This is big money. And we need to remember that people are doing this. So the kids that were buying the creatine or their parents that were buying the creatine, we need to know that kind of stuff. Okay, everybody stand up. Stand up. You know, you can say this session gave you some exercise or something. All right. Now, this is so fun with a class of 77 medical students because I used to always get somebody that was resistant. But now sit down if you have done this therapy yourself. Okay, I'm standing up. Hypnosis, Reiki, Tai Chi, biofeedback. Okay, I'm down. I tried biofeedback for my jaw clenching. Chinese herbs, light therapy, magnet therapy, acupuncture. I tried acupuncture for my jaw pain. Rolfing. I love Rolfing. Rolfing. Oh, well, you've heard Marianne Wassel on this on Echo, but it's fascial massage. It's not muscle massage. It's fascial release, and that hurts. But oftentimes the medical students are like clueless about a lot of this. Oh, you know what else I say to them? I say, who's got chronic pain here? Because when I was your age, I had no chronic pain, but now I do. So now I'm talking to you. So chiropractic, definitely use chiropractic, similar to osteopathic manipulation, herbal remedies, aromatherapy, reflexology, Ayurveda, nutritional supplements. Almost everybody's usually now sitting by here. Probiotics, tapping therapy, and we have talked about that on oh, and we had Carolyn Sakai on Echo as well. Okay, meditation. We know meditation has increased significantly in the last few years. Healing touch, Qigong, native healers, homeopathy, dietary supplements, Pilates, yoga. Is anybody standing up still? Because we got prayer now. Oh, that's on there twice. I got to get that out of there. Music, yogurt, vitamins, massage, and deep breathing. So usually by the time I get through this slide, all the medical students are sitting down, except one surgeon in the corner, one future surgeon. Bless their soul. No, this last week, I think I lost them right around here somewhere. So they were all sitting down. So yeah. Anyway, so then, you know, why am I telling you this? Well, as I said, if you want people to trust you, you want to listen. You want to listen, you want to be on their team. And these young future doctors need to be open-minded to all kinds of things because you're going to hear some crazy things, as you guys know. And you want to hear those crazy things because you want to hear your patients' fears and their deep, dark secrets that are worrying them. And I am proud when somebody tells me something that I did not realize. And so I have a story here. You know me, I like to tell little stories, but I had a patient and I was doing women's health. And I went into the room because the chart said she wanted a pap smear. And she looked like a young man. And I said, oh, I'm sorry, I've got the wrong room. And I left. And then I had to go back in and say, I am so sorry. I am so embarrassed that I, you know, thought you weren't here for a pap smear. And she's like, it's okay. We're doing a pap smear. And then the next time I saw her, she opened up a little more and she said, I dressed this way on purpose because I was in jail. And even out of jail, I got harassed. And so I dress this way so I won't get harassed. And I felt very special that she would tell me her reason. And we talked about, you know, what she could do for it and stuff like that. So I felt very proud that she would trust me to tell me that. And I told her, you know, that was one of my most embarrassing medical situations when I thought you were a boy and said, left the room. And so, we were able to share. So anyway, they know at Harvard that folks are using integrative medicine, but they don't tell their doctors. And they don't tell their doctors probably because they don't trust us. And I don't want that to be the case in Hawaii. I want people to be able to say, I'm really anxious because I imagine all these cancers I have. I'm worried about this cancer, doctor. What should I do? And that I can talk about. If they don't tell me, they're just going to be anxious and not tell me. So another reason I'm telling you guys and the med students, because I want you to know where to look. Because I can't even remember all the medicines in healthcare. How am I going to remember all the natural products too and what interactions? So I don't even bother myself with trying to remember it. I just know where to look it up. And that's my motto in healthcare. So what you want to ask yourself is, what is the evidence? Do these things work? Do they interact? Are they safe? Will they work for what I'm trying to get them to work for? Are they going to interact with other therapies? And is this all of it? Is there more? And if I want to use it, how do I get it? And I'm still not clear on that for some things. Where do I find a good practitioner? And I can't tell you the answer to that one, but we can start. All right. Now, these are things that are really hard to answer. So I tell the med students, these are the ones you got to send your patients back to their insurance company for. Is it covered? Some things like chiropractic used to never be covered. Now it's almost always covered. Do you have to do a prior authorization request for it? Usually chiropractic not. Acupuncture is now getting on the list of covered. So it's one of those gray areas. Massage may be covered if there's prior authorization, but do you have to go to a certain person? Maybe. Do I need a referral for it? Some insurances, you have to refer people. Some, they can just go wherever they want. Does coverage require seeing a practitioner in my network? Is there a network? Is there a network here for acupuncturists? Or can I go out of network? Well, in Hawaii, usually there's no network for a lot of these things. So, we're mostly out of network. Are there any limits? Can I get a certain number of visits before I have to pay? And that's actually true in Hawaii for a lot of physical therapy things, which is absolutely covered, but maybe 4 visits, 6 visits, etc. How much do I have to pay out of pocket? Is my copay the same as when I come see a psychologist, a physician? Is it the same copay? Is it $15 every time? Or is it completely covered? So these are things that people want to know, but they don't necessarily know, or you don't know. Okay, so the med students have a case-based educational program. So they get a problem-based learning case. It's on paper or the computer now. And so one of their patients, and they follow these patients long-term. So Paul Isaac, they meet his whole family. But he is a 57-year-old male who comes in for different things, but he's on no prescribed medicine, but he takes zinc when he feels a cold coming on and ginkgo biloba to support his memory. So these are the things that get the students thinking. And one thing they should be thinking is, does zinc help a cold? And does ginkgo biloba help your memory? And so the med students have already had this by the time they meet with me in January on this. And so this is where I tell them to go find information. nccih.nih.gov, National Center for Complementary and Integrative Medicine, because this is where they will find, here's the page, and we can go to it in a minute. They will find oral zinc lozenges may reduce the duration of the common cold if you start it within 24 hours of initial symptoms and taken for a time period. Don't take it more than 2 weeks, whatever you do. But intranasal zinc has been linked to a severe side effect, loss of smell, and should not be used. And I don't know why that would cause loss of smell, but maybe lining I don't know, I'm just guessing. So here's the reference for that one. And then the ginkgo biloba, what do you guys think? Does it help memory? Because we've had this discussion at some point in the last couple years with our memory talks. Ginkgo biloba, anybody think? I have red eye. I have red yes. Okay. I can't remember. Seems like ASMR is knocking on the door, also has been effective as a supplement to therapy in addressing anxiety. Oh, yes. Okay, well, I thought it did. I thought it did, but there's no conclusive evidence that it's helpful for any health condition. But there's also nothing on side effects. So, if he wants to do it and he thinks it helps, then it helps. Because placebo helps 25% of the time, right? That's the miracle of it.